Healthcare in Kenya is complex, with plenty of unknowns. It is not just a straightforward matter of healing the sick. Getting healthcare can be a matter of life or death. Far too often, it becomes a battle against systems, against greed, against those who are meant to save you, but who are only interested in helping themselves.
The child was referred, but the ambulance transferring the child from Kajiado diverted them to the private facility, Abian Hospital in Isli.
3 months ago, these words shook the nation. This is Esther Olavu, a young mother who claims her baby was detained when she could not pay the bills. But to understand Vikram's story, we must go back to where it all began. I must caution you though, Baby Vikram's story is far more complex than one family's pain.
A hospital can set aside 100,000 shillings aimed at meeting 10 ambulance providers. Then a meeting is called and a discussion is held with the aim of forming a partnership that will end up with these ambulances taking referred patients to that particular hospital.
This is Vikram King, once full of life, full of promise. Born in 2024 in Loitoktok, Kajiado County, his family knew him as a playful, innocent child. He was the joy and pride of the family, brightening a homestead with his everyday jovial mood. However, a complication had been detected shortly after birth.
Nilipojifungua huyo mtoto ilikuwa date 16 June 2024. Baada ya kumwangalia nikaona kuna shida katika sehemu yake ya kukojoa. Nikaona hayuko kama boy wengine wenye wanakuaga. Na sasa akaniambia tutampeleka kwa daktari wa surgery, tutampeleka aende akamwangalie, atuambie nini tatizo. Daktari akamwangalia, akasema hiyo ni kawaida, huwa wanazaliwa hivyo. But wakifikisha 1 year wanapelekwa operation, wanafanywa surgery.
Haswa shida ilikuwa nini uliona tofauti?
Niliona tofauti kozi watoto vijana wakizaliwa wanazaliwa hiyo ngozi inakuwa imefunika ile nini kabisa. Yeye ngozi yake ilikuwa wazi hapa mbele, haijafunika. Daktari akamwangalia akaniambia unaona hata shimo yake baada ya kuwa hapa mbele iko na hapa hivi chini. So ilikuwa itahamishwa hapa chini iwekwe hapa mbele. Hiyo tu ndio ilikuwa shida, but mtoto alikuwa anakojoa vizuri, hakuwa na shida yoyote, hakuwa isumbuka kukojoa. Ni ile tu unasema wacha juu daktari amesema inarekebishwa, wacha tu nitapeleka aende akarekebishwe.
Olavu was advised to wait for a year and she was patient. In July 2025, Baby Vikram turned 1 and doctors at Loitoktok Sub-County Hospital gave the go-ahead for him to undergo a corrective procedure for a condition he was born with. However, something had gone wrong. As hours passed, Olavu's worry grew. No one was telling her what was happening. Doctors at Loitoktok Sub-County Hospital needed to operate on Baby Vikram. He was diagnosed with hypospadias, a birth defect where the opening of the urethra is on the underside of the penis rather than at the tip. Normally, if left untreated, it can lead to complications later in life. This condition needs surgery to correct it. The routine surgical procedure initially went well, but there were serious complications. The doctor's notes pointed to a reaction to the anesthesia used during the operation, which left Vikram unstable and struggling to regain consciousness, where his body struggled to stabilize, his breathing became weak, and he failed to wake up as expected. The report stated his condition was still pathological, meaning he had not regained consciousness and needed urgent specialized care. Doctors referred him to Kenyatta National Hospital, a level 6 facility equipped to handle complex cases like Vikram's. He needed advanced care to stay alive.
Madaktari walisema mama, tafuta 50,000 tupeleke mtoto Kenyatta, ama utafute 100,000 tupeleke mtoto KU. Itabidi tu nitafute hiyo 50, 100,000 ni ngumu kupata. Wacha nitafute hiyo 50,000 tuende Kenyatta. Ndio akasema KU ni mzuri sana, si uongezee tu hiyo 50 tuende huko KU. Nikamwambia nimekataa peleke KU kwa sababu sina pesa.
Although the referral letter from Loitoktok Hospital directed the patient to Kenyatta National Hospital for advanced care, instead, Vikram and his mother were taken to Abian Hospital, a private hospital in Isili. Vikram's mother believes that what happened to her son was not an isolated incident, but rather points to deeper systemic gaps within the medical fraternity.
Mtoto alikuwa ameshachoka, hewa ilikuwa inaenda ikikata, imefika 75, mapigo ya moyo imeshuka, imefika 75. Sasa sikawa tu sina namna, mtoto ashuke aingie. Kwa nini aingizwe ICU haraka? Wale wa madaktari walituambia mtoto akifika ICU atachukua 3 hours amke na mrudi na hiyo ambulance. Hata dereva wa ambulance alikuwa anasema hataenda, atuache mpaka mtoto amke turudi na yeye.
According to the Kenya Health Facility Master Registry, Abian Hospital in Nairobi's Isili area was established in June 2023 and was registered in December 2024. It is a modest facility with 1 operating theatre and 12 inpatient beds. The incident with Baby Vikram was not the only one involving Abian. Another family in Kariobangi South was fighting a similar battle.
Kwa majina naitwa Cynthia Gonya Ningu. Mimi ni mkaji wa Kariobangi South. 3rd of June mama alikuwa vibaya sana. Tulita hadi Uber ingeza mbeba juu. Angeza jiweza. Familia ikajikaza ikatutia ambulance. So ambulance ikakuja, okoa ambulance. wakachukua mom.
The ambulance was supposed to take her to Kenyatta University Teaching and Referral Hospital, but the emergency medical technicians had other plans.
Tukafika hapo kwa njia wakatuambia kuna hospitali mzuri Isili. Tukishafungua SHA tunalipa 7,800 ya SHA. Ikishatufungulia inalipa 28,000 kila siku. Na tukitoka huko hata tutakuwa na wasiwasi, ni SHA italipa. Nikaongea na familia ikasema ni sawa. Beta huko itatoa 28k, hiyo at least itatusaidia na mzigo zingine. Na tatoka huko na SHA. Tukamwambia ni sawa tupeleke huko. Hata kwa kutuambia tu sign, hao ndo walifanya kila kitu, hao ndo walimuadmit, hao ndo walifanya kila kitu. Sisi tulikuwa tumekaa. Hata tukusign commitment nini hatukusign. Wakatupeleka, wakaadmit mama akastabiliziwa kila kitu nini.
While Beatrice was being admitted at Abian, something sinister was unraveling. On her daughter's phone, a string of text messages between Cynthia and a member of the very ambulance team that had taken her mother to Abian Hospital. At a first glance, it seemed like casual follow-up from a concerned person. But one detail stood out. Over and over, the same question. Not only about Beatrice's recovery, but about money. Specifically, whether the family had settled the full deposit required for her treatment. The repeated focus on payment rather than treatment raised suspicion. Why would an emergency medical technician, whose role ends once the patient is admitted, be disinvested in whether the patient has made the necessary payments? Desperate and unable to afford treatment, Beatrice's family was hit with a massive bill that they could not afford.
After 14 days, ndio tunaambiwa tunafai kulipa. Imefika 1 million. 1,100 and something thousand. Tunafai kulipa. Hapo ndo saa kizungumkuti kaanza. Sisi tuko tunakaa tukidhani SHA italipa kila kitu. Sasa nikarudi kwa simu nikauliza hao watu. Simu tuambia SHA ndio itatoa mama hiyo hospitali atufai kulipata bili yote.
14 days later, the medical bill rose to more than 3 million shillings. The family turned to the Milimani Law Courts in Nairobi, to which the presiding judge, Justice Lawrence Mugambi, directed that Beatrice's family be allowed to see their loved one and take her to another facility. When they finally saw her, the damage was already done.
Ilifika hiyo one point, wakakataa tuone mama. Juu bili imesonga, atulipi. Tukamwambia sha tulidhani sha italipa kila kitu 28,000 ni venye tulielezea venye ambulance amesema. Akasema hapana, au kuna pesa yenye wanalipa.
But she was not the only one. Winter, not her real name, requested to remain anonymous and declined to appear on camera for this documentary. However, she shared details of her alleged horrifying experience at Abian Hospital, claiming that she was detained and abused for 4 months because she could not pay her medical bill. Different women, same story. Allegations of a hospital where patients are not treated, they are detained. At the heart of this story is a woman who says she was trapped with her baby within these walls. For Esther Olavu, Vikram's mother, it was not just about the medical bill. No, it was about the well-being of her son. It was about the recovery of Vikram. Esther had arrived at Abian, not by choice, but allegedly by diversion. She carried with her a referral letter to Kenyatta National Hospital. Yet, she and Vikram were locked inside Abian's ward.
Mwanzo walipomaliza 1 week, tulitoa bili ya 1.3 million. Walipoona hatuna pesa, wakatuambia kuingia hapa ingieni kama visitors wengine. Hakuna kuingia kila time. Tukaanza kuingia kama visitors. Mtoto si alikuwa anakula, wao hawa provide food ya mtoto. Ni sisi ndo tunanunua chakula mtoto. Kienda asubuhi saa 1 asubuhi ndo time ya visit, saa 1 mpaka saa 2. Kienda asubuhi hiyo saa 1 unaenda wanahakikisha unanunua food ya mtoto mpaka hiyo asubuhi. Instead of getting better, Vikram's condition worsened. His mother says nurses ignored her cries to properly attend to her son. Tukienda kuangalia mtoto, tunakuta mtoto wetu anazidi kukauka. Shingo ishaka hivi, hairudi hivi. Mikono haikunjiki hivi. Vidole zimekunja hivi. Kinyosha hazinyooki. Ukimguza hapa kwa mgongo kumeshakauka, mabega imekauka, yani anakaa kama amekauka tu karibu mwili yote. Miguu ndo hazikuwa zimekauka, but zilikuwa zimeanza na zenyewe. The bill soared past 1 million shillings. Esther had no way to pay. According to the medical bill provided to the mother, Vikram was receiving intensive care services, oxygen, nurses at his watch day and night, among other critical services. Kiuliza kwa nini mtoto afanywe mazoezi, na mwanzo tulipokuja alifanywa siku kadhaa. Walipoona hatuna pesa, wakaona hawataendelea kumfanyia mtoto matibabu vizuri. Ndo akatuita akatuambia, si mliambiwa mtoto atakaa muda mrefu bila kuamka. So mnaweza tafuta hospitali nyingine kama yenye mnaona mnaezana na yenyewe, mpeleke. Mnaweza tafuta hospitali ya serikali. Tukamwambia tutatafuta hospitali ndio, na pesa tutatoa wapi ya kukulipa ndo tuchukue mtoto. Akasema malipo iko ya aina nyingi, tunaweza andikiana title, na hiyo title iko ya Nairobi, ama tuandikiane logbook, na hiyo logbook iko ya gari ya V8.
The child was referred to Kenyatta National Hospital, but the ambulance transferring the child from Kajiado diverted.
It was only after the media raised an alarm that Esther's story came to light.
Now the child is fighting for his life in ICU without parental care, as the hospital has barred the parents from seeing the child until they pay a bill of 3 million shillings.
Under public pressure, the Kenya Medical Dentist Practitioners Council, KMPDC, became involved in the Baby Vikram matter, and the baby was released. An ambulance rushed Vikram and his mother to Kenyatta University Teaching and Referral Hospital. The ordeal had already taken its toll. This case forces us to ask how many more families allege they have faced a similar situation at Abian Hospital, raising questions about the conduct of some medical practitioners. Article 43 of the Constitution of Kenya, 2010, guarantees that every person has the right to the highest attainable standard of health, which includes the right to healthcare services. But is this the case? At first, it was impossible to get answers from Abiyan Hospital how Vikram ended up in their facility. However, behind the veil of silence, we knew there was something more sinister, so we kept digging. To understand how referrals are meant to work in Kenya's health system, we saw the insights of Dr. Boniface Opondo, a general medical practitioner.
Picking my patient, there are normally two ways. Number one, it's either we have an ambulance as a referring facility, which will dispatch to the receiving facility. And they're going to go with the referral note, plus the person that I was in contact with. So that's a proper referral process, but it all just lies in documentation and information.
Dr. Opondo's highlights are backed by official records which indicate Abiyan Hospital is a level 3 health facility, while Loitoktok Hospital is classified as a level 4 by the Kenya Medical Practitioners and Dentist Council. The regulator of medical practice and health facilities in Kenya confirms it. Vikram was diverted downwards from a higher level hospital to a lower one, a move that defies both logic and policy. One source after another confirmed the story, but it was one insider who shared with us how some facilities incentivize the practice to redirecting patients against the established policy.
These upcoming hospitals have agreement with EMTs that if you pick a patient, you transfer or you convince the patient to come to us. So when the patient comes to our hospital, they appreciate you. They give you a token. So the patient who was supposed to move from hospital A to B, as an EMT, I convince the patient or a family member to go to the hospital that I will get a token.
A system built on commissions, on lies, on holding patients hostage.
The agreement is we get a call. Yeah, the discussion will be, who tutampeleka wapi? Unaona, where will we take this patient? And then you assess the financial situation of the family. Can they buy to our story? Can they listen to us? You look at the one that is emotionally connected to the patient. Then this is the person you target and keep talking to. In the process, if I come with a patient, it is either we split the token 50-50 between the EMT and the driver. There are different traits. ICU, HDU have different traits.
Meanwhile, we get an update from Mulavu on Baby Vikram's prognosis, and the news was heartbreaking.
Tulipokuja KU, tulikaa 3 days. Daktari akatuita meeting. Sema tumeangalia, tumeona hiyo injury ni kubwa kwa brain, ambapo imesha pahali pa kuona pamekufa, mtoto ataona. Pahali pa kusikia pamekufa, hata sikia. Pahali pa kupumua pamekufa, ndio maana tunaona hapumui na lungs zake ziko sawa na hawezi pumua mwenyewe. Pia kupumua hataweza, imepata injury. Pahali pa kutembea, pahali pa kukula hataweza kukula huyo mtoto. Yaani hakuna chochote kile kwa mwili yake kitafanya.
Listening to Lavu, I could tell that the mother of 3 was pained by the revelations. We sought to speak to the individuals mentioned in Beatrice's case who allegedly redirected her to Abiyan Hospital where she was mistreated. So Cynthia shared a contact of one of the individuals that she says misled them from going from the hospital of their choice to Abiyan Hospital, which is in Isili. So I'm going to call the individual just to hear her side of the story. I'm calling to ask about an incident back in June 3rd this year.
Yes.
Where you picked a patient in Kariobangi by the name Beatrice.
The patient was taken to a facility called Abiyan Hospital in Pangani.
Abiyan Hospital?
Yes.
According to the family and the details I have, they had requested to be taken to a different hospital.
Yes.
So how did they end up in Abian?
They were to go to Mbagathi.
Mm-hmm.
I called Mbagathi
Yes.
with the daughter as my witness, and Mbagathi, they say they cannot handle the patient.
Mm-hmm.
Called KNH because the patient was to go for a procedure at KNH.
Mm-hmm.
KNH, they say they have their ICU beds full because according to my assessment, the patient was not to go home, to go to the hospital and then go back home. She was to be admitted for an ICU.
Okay.
Then they had a relative that was working at KU.
Mm-hmm.
The relative told us to proceed to KU without calling. We were going to find him there.
Yes.
When we started going to KU,
Mm-hmm.
on our way to KU, the gentleman called back
Mm-hmm.
and told us to go to Abian Hospital themselves. I have no idea of that.
Are you part of the team? Maybe.
Which team?
Of misleading patients?
No. We take patients where they want to go.
That is unprofessional. If it happened, that is not our policy. That is not, we don't do such things. If you pick a patient from home, these patients have the right, they give the hospital of choice. You want to go to KU and they will take you to Abian? No.
It pains me to see vulnerable families being exploited in the hands of professionals, and I think this is something that needs to be worked into. We need to review or revise our oath when we came from training, so at least we know we are there for the patient, and the patient relies on us 100%.
The Kenya Medical Practitioners and Dentists Council announced a move to regulate emergency services. All EMTs and ambulance providers, public and private, were ordered to register with the council with a deadline set for 15th September 2025 to act. The KMPDC statement explains that the move was meant to standardize, support, and enhance the quality of pre-hospital healthcare. A new directive in place, already some families remained unprotected. And for Esther and Cynthia, the damage was already done. After weeks of tracing families, piecing testimonies together and uncovering the practice of diversions and detentions, we sought answers from the hospital at the heart of it all, Abian Hospital in Isili. On paper, this should be a well-established facility, and given the cases of patients being diverted there, we expected to find a proper, well-equipped hospital. However, this Level 3 hospital is located within a rented space. How many days? The hospital's management agreed to an on-camera interview, saying it was time to clear the air surrounding the allegations, which they claim have deeply damaged the facility's reputation.
Before this incident, we were Level 4 and still we are. But because of the ongoing investigations, the facility has been downgraded.
The management of the hospital insisted the facility does not detain patients, neither does it influence ambulance diversions, and that every admission follows legitimate medical channels.
We receive a call. Can you offer these services? Yes. Is bed available? Yes. Proceed. If I may take an example again, you found yourself in Abian Hospital. Day 1, day 2, day 3. If you're not contented with the services, number 1, we offer bills daily. That's the regulation. If you're not contented with the services, if you're not contented with the billing, there's an option for referral.
Maybe you could watch that clip, showing Omar the video clip of one of the patients allegedly assaulted inside Abian. He had this response on the issue.
It is self-inflicted because ni mimi nilikuwa hapa.
And as for the mounting allegations of diversion, collusion, and patient detention, the management dismissed it all as part of a bigger business rivalry.
And still as a facility, and every mfanyikazi wa hapa ndani, every worker is 100% aware that this is more of political than the fact.
Concerning alleged exaggerated medical bills, the facility's management said the following as a response.
The client is under treatment, ABCD, but we give the client the bill. There's an agreement form that they sign. Do you want to pay the bill daily? Do you want to pay it weekly? Do you want to pay it monthly? Or do you want to pay it upon discharge? So most clients choose upon discharge. Okay? And we are not, it is not something sikitu mgeni kwetu. It is the outcome of human beings. Lack of appreciation.
I'm sure Loitoktok would not have referred this baby if there was something that they could manage conservatively without using a machine. They could have just retained the baby, because nobody likes to refer their complication, by the way. Because you see, a head CT scan was done here at KU that said hypoxic ischemic encephalopathy. You see.
What does that mean?
And it just means the brain was lacking oxygen.
There was more to interpret from the medical reports.
I'm saying from the complaint, it's also being captured that actually this baby had a cardiac arrest. Like the baby literally died twice.
When we first met Esther, it was here in Nairobi. She had left her home in Kajiado, clinging to hope that her son Vikram could be saved. But despite doctors' efforts, despite her prayers, despite the public outcry, Vikram succumbed while undergoing treatment after suffering a cardiac arrest. After our visit to Esther, we reached out to Cynthia via WhatsApp yet again. Another devastating message. After weeks of alleged abuse, neglect, and mounting bills at Abian, her mother was finally transferred to Kenyatta University Teaching and Referral Hospital. But her body gave up, and she passed away. At the center of this expose are two hospitals, Abian Hospital and Loitoktok Sub-County Hospital. It has been months since the incident of Baby Vikram happened. I want to call the management of Loitoktok Sub-County Hospital and just to hear from them if any investigation or a follow-up has been made on this particular matter.
Hello.
Hello, good afternoon, sir.
Good afternoon.
My name is William.
Yeah?
Yes, I am following up on the issue of Baby Vikram.
If you need information about a patient, you have to come to the hospital.
Yes.
And that is the only way you can get information for patients.
So in light to our conversation with the med superintendent of Loitoktok Sub-County Hospital, I'm going to write him a text message to request for a formal and an on-camera interview and to see if he will agree to it and respond to some of the questions that we have. We are here to get a feedback from Loitoktok Medical Superintendent. Further, in pursuit of accountability, we reached out to all key authorities entrusted with Kenya's healthcare oversight, including the Ministry of Health, the Kenya Medical Practitioners and Dentist Council, and through detailed letters, we sought clarity into Abian Hospital and the case of Baby Vikram King. While the Ministry of Health remained silent on our request, the Kenya Medical Practitioners and Dentist Council responded, confirming that they had launched a comprehensive investigation into the referral and treatment of Baby Vikram at Loitoktok Hospital and the alleged diversion from Kenyatta National Hospital to Abian Hospital. The council termed such diversion as a grave ethical violation and confirmed that both facilities remain under active investigation. It further reaffirmed that detaining patients of unpaid bills is illegal, unethical, and unconstitutional. 2 lives lost. Despite these serious allegations, Abian Hospital remains opened. Vikram succumbed while undergoing treatment after suffering a cardiac arrest. Months later, we traveled by road to Kajiado, to a mother's home, now filled with silence.
Alikuwa tu sawa, maana nikamchange paka diaper, nikamuomba nurse hiyo usiku juu hakuwa na ruhusu tumchange, mama amchange diaper, ni alikuwa anamchange. Sasa tukwenda home kesho sasa 6 asubuhi. Nurse akapiga simu. Inaweza kuwa ni hali ya mtoto kweli ama kuna habari nyingine. Tukajitayarisha tukatoka hiyo 6:30 tukatoka. Mzee akaingia kwanza akaniacha mimi nje. Alipoingia sasa ndo akakuta hiyo taarifa kwamba mtoto amepumzika. Akitoka hapa nyumbani, Vikram alikuwa ni mtoto mzuri mwenye afya zake, hakuwa na shida yote ya mwili, Hata kama ningejua kuna hii kitu ingeenda kutokea, ningemwacha tu. Sasa hii angekuwa tu sawa. Alitoka akiwa vizuri, anaongea vizuri, amechangamka vizuri. Kurudi ndo amerudi akiwa kwa jeneza.
Ibada hii fupi kwa maombi. Wewe jipe tu moyo, maana hii ndio njia ya kila mmoja. Sawa sawa Hivyo ni vizuri kujipatia moyo na kujiuliza, mimi nimejipanga aje siku yangu ikifika? Labda nitaondoka namna gani?
At the beginning of this documentary, we said that in Kenya, healing has become a privilege and how costly that privilege can be. But it does not have to remain this way. Healthcare is not a favor, it is a right. It is time the government invests and strengthens public healthcare, where every Kenyan, rich or poor, can access all essential services under one roof without fear of death or detention. The question now is not who failed, but who will fix what's broken, where mothers bury their children and where children bury their mothers. Hi, my name is Moige William, a reporter and producer at Africa Uncensored. Thank you for watching this documentary. You are our #1 supporter. To maintain our independence, in-depth and balanced documentaries, we request for your invaluable financial support. You can become a member on all our platforms or even our patron on patreon.com or send us money via M-Pesa Direct. Thank you.